The next section that we're going to look at is establishing gestational age. What is the duration of the pregnancy? We've already talked briefly about this, but let's go into some detail. Pregnancy can be dated a number of different ways. The ideal way would be by looking at conceptional gestational age. Conceptional gestational age, in terms of delivery, is 266 days or 38 weeks from conception. If you know when conception occurred, that would be the precise method. Patients who are pregnant because of ovulation induction know when ovulation occurred. Patients who are pregnant because of artificial insemination. Patients who are pregnant from in vitro fertilization and the date of embryo transfer and IVF is known. This is going to be precise and much, much better. Most of the time, however, the date of conception is not known precisely. What is known is when the last menstrual period was. If we know when the last menstrual period was, we will say the estimated due date is 280 days or 40 weeks from the last menstrual period. Now remember, this assumes a 28-day cycle, which then further assumes that ovulation occurred on day 14. Is that what happens in most women? And probably most women do not have a 28-day cycle. It may be plus or minus 7 days, anywhere from 21 to 35 days. An inexpensive and cheap way of calculating the due date is by using what we call Nagel's rule. Now, who was Nagel? Probably some old venerable obstetrical saint back years ago. What you do here is you take the last menstrual period, you subtract 3 months, add 7 days, and you come up with a reasonable facsimile of what the due date is. This is a pregnancy wheel, and we use this to calculate the due date. Let's look at some examples here. Let's take the first day of the last menstrual period was December 21. If that is precise, and if it was a 28-day cycle, we can assume the conception probably occurred on about January 5. Currently, if our current date is on February 5, we can say that she is 6.5 weeks pregnant. Her due date then is going to be about September 25. This is a pregnancy wheel which is used most commonly, and remember, it assumes a 28-day cycle. Here's Nagel's rule. If the last menstrual period is July 4, we will subtract 3 months, June, May, April. We will add 7 days. 1, 2, 3, 4, 5, 6, 7. LMP, July 4, estimated due date, April 11. Another way of assessing for pregnancy duration is identifying ovulation based upon basal body temperature. This is a basal body temperature graph. This is done by the woman. She puts the thermometer in her vagina before she arises out of bed, before she takes anything by mouth, and we want to get a basal temperature. And you can see here the basal body temperature is somewhere around 97.6 to 97.8. Someplace over here, notice the temperature goes up. What is it that causes the basal body temperature to go up? It is probably the thermogenic effect of progesterone on the temperature regulatory center of the brainstem. And that then resets at about 0.5 degree higher. When did ovulation occur? Someplace between the basal temperature here and the basal temperature here. If progesterone is produced by the corpus luteum, and the corpus luteum arises from the site of ovulation, how long will it take from the time of ovulation until there is enough progesterone produced to raise the temperature. It's not going to be immediate. I would say certainly within 12 to 24 hours. So it's not precise, but it gives you a reasonably good estimate of when ovulation occurred. Another way of dating the pregnancy is by menstrual history. The last menstrual period tends to be reliable if it was a definite last menstrual period. Normal menstrual cycle, planned pregnancy. If I ask a patient, when was your last menstrual period? And she takes out her little black book and she says, my last menstrual period was on August 3 at 5:14 in the afternoon. How accurate is that? That's extremely helpful, extremely helpful. What if I ask a patient, when was your last menstrual period? And she says, well, let me see, was it when we had the earthquake? When my mother-in-law came to visit? I'm really not sure. See, that's not nearly as helpful. Normal menstrual cycle. Does she have predictable 28-day cycles, predictable 31-day cycles? Was it a planned or unplanned pregnancy? The most helpful is a definite last menstrual period, normal menstrual cycle, planned pregnancy. This figure looks at the length of normal women's menstrual cycles. And you can see that the mode, the mean, and the median is about 28 days. But by no means does this represent most women. You can see women have shorter menstrual cycles, longer menstrual cycles. And we can generally say if it is minus 7 days, which would be 21, or plus 7 days, which is 35, you can see that captures almost all women who have normal menstrual cycles. So we can see the normal menstrual cycle is anywhere from 21 to 35 days. Let's look at how this fits in terms of ovulation. Here we have week 1, week 2, week 3, week 4, and week 5. This is a 28-day cycle. This is a 21-day cycle. This is a 35-day cycle. Now, what do you see? You see that the post-ovulatory or secretory phase is constant. What part of the menstrual cycle varies then? It is the pre-ovulatory part that varies. Why is the secretory phase constant? Why is the post-ovulatory phase constant? Because it is dependent upon the lifespan of the corpus luteum. And when progesterone levels start to fall, as the corpus luteum involutes, that's when you have the menstrual period. So regardless of whether she has a 21-day cycle or a 28-day cycle or a 35-day cycle, the lifespan of the corpus luteum is fairly well fixed. So the woman with a 21-day cycle, she ovulates on day 7. The woman with a 28-day cycle ovulates on day 14, and the woman with a 35-day cycle ovulates on day 21. And that's really important to know. Let me show you how that figures. Here we have a woman who has conception on day 14. She has a 28-day cycle. Notice the size of her embryo. Here's a woman who conceived on day 7. And she has a 21-day cycle. This is the size of her embryo. This is a woman who conceived on day 21. She has a 35-day cycle. This is the size of her embryo. Now, all of these women have the same last menstrual period. But are they the same gestational age? Well, you can see clearly they're not, because the date of conception varies. So it's important to adjust by the length of the cycle. So if we use our wheel, which assumes a 28-day cycle, and the patient in fact has a 21-day cycle, what we're going to have to do for the due date is to move it 7 days earlier. If she has a 35-day cycle, we're going to have to move the due date later. You get the idea here? It's important to make that adjustment. Okay, gestational age can be identified using clinical landmarks. And those are on this next slide. We can identify fetal heart tones with a Doppler stethoscope at 10 to 12 weeks. That's going to be very helpful because prior to 10 weeks, you're not going to hear it. If you have a thin-walled abdomen, if you have a patient who doesn't have a retroverted uterus, you can hear them at 10 to 12 weeks. That's very helpful for dating. Now, if you hear fetal heart tones with a Doppler stethoscope at, say, 18 to 20 weeks, not nearly as helpful in terms of dating. You want to pick it up as early as possible. The same thing is with a fetal heart tones with a fetoscope. Now, this is done with air conduction. I'll show you a picture. We used to use that before there was the electronic device. Again, this is going to be most helpful when it is obtained as early as possible, and that's going to be around 18 to 20 weeks. You won't be able to hear it very well prior to that. Quickening is a term which represents the maternal sensation of fetal movement. And you notice a woman who's had previous pregnancies, a multigravida, will be able to identify quickening at 16 to 18 weeks, whereas a woman who's in her first pregnancy, it will be 18 to 20 weeks. Now, what is the difference between these? Well, the multigravida, when she feels it, she says, "That's my baby. I know it's my baby moving." When it's a first pregnancy, the woman will often say, "Well, I'm not sure if it was my baby or if it was gas." So the previous experience is going to make a difference in terms of quickening. Here we have a Doppler stethoscope. You can see an electronic signal. What is nice about this is the mom can hear the fetal heart as well. And you can buy these at different costs. This is one which has a digital readout, which for the person who doesn't want to count is very helpful. And here I am putting this on the patient's abdomen, and we're listening for the heartbeat. This is used nowadays in almost all offices. This is the old style Delis fetoscope. And I haven't used one of these for decades. You need to have a long bell. If you try listening for fetal heart tones with the diaphragm of a stethoscope, you're going to have a hard time hearing them because the fetal heart tones are a very low frequency. And low frequencies are best heard with a long bell like this. The disadvantage of this device is the mom can't hear them. Fundal height can be helpful for identifying the gestational age, particularly after 20 weeks. After 20 weeks, the fundal height should measure in centimeters the number of weeks gestation. And this image from my BRS book shows it very nicely. At 8 weeks, the uterus is so small you can't feel it abdominally at all. At 12 weeks, it's just coming to where you can feel it above the pubis. 16 weeks, it's going to be midway between the pubic bone and the umbilicus. After 20 weeks, the weeks of gestation should equal the centimeters from the pubis to the top of the uterus. Now, prior to 20 weeks, you're not going to measure 16 centimeters. What I say is it's 16-week size. But after 20 weeks, it should approximate the number of centimeters. Let me show you an example. Here I am measuring the fundal height from the pubis to the top of the uterus here. This is the umbilicus. Let's count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. And there you are. Now, is it going to be exactly 20 at 20 weeks? No, you're going to have some variation. And I say typically 2 to 3 centimeters variation is certainly within the norm. Now, here we have a patient who is 20 weeks gestation. She doesn't look 20-week gestation. She looks bigger than that. Why? She's got triplets. That's why. And of course, this is only if you have a single fetus. If you have multiple gestation, that's going to make a big difference. Now, we already talked about ultrasound dating. In the first trimester, we use the crown rump length. In the second and third trimester, we use 4 measurements. We use the biparietal diameter, which is the head from one side to the other. We use the head circumference, which is the perimeter of the head. We use the abdominal circumference, which is the perimeter of the abdomen transversely. And we use the femur length, which is here. We have nomograms which we can use to identify what is the average gestational age of the biparietal diameter, the average gestational age of the head circumference, the abdominal circumference, and femur length, and then we take those 4 measurements and come up with a composite, which is an average of those, and that will then give us the gestational age after the first trimester. Here is a view of the transverse abdomen. This is the abdominal circumference, or AC. Here is the fetal head, and you can see the cranium right over here. This is the head circumference, and this is the biparietal diameter. Here we have the femur length measured right here. So those are the 4 measurements that we use after the first trimester to assess gestational age. Now this is in your notes, and what it shows is that there is a variation in ultrasound accuracy of gestational age dating. Less than 12 weeks in the first trimester, the accuracy is plus or minus 5 days. And I've illustrated this by the red bar. Once we get into the second trimester, 12 to 18 weeks, you notice the plus or minus is now 7 days. 18 to 24 weeks, it is plus or minus 10 days. 24 to 30 weeks, it is plus or minus 14 days. Can you see what's happening? The further along in the gestation, the wider and wider becomes the normal variation. The accuracy then becomes less. And here you can see with advancing gestational age, the